part of it. However, wearing compression stockings, but here in St. Lucia it gets hot,
It gets
and
so
that
hot.
yes, so that's difficult to do. But keeping your weight down, that can help. Exercising, drinking lots of fluids, but on the genetic component you cannot change.
But is all of it genetic?
It's mainly genetics.
Really?
Yes.
Oh, so
Yes.
if your mama or your papa has spider veins, it's almost certain you'll have it?
Mom, and if you have it on both sides, that's a high likely that you're going to have it.
Oh.
But having it on just one side, 25% chance.
Okay.
Yes. But there are other factors that contribute to it. Being female or hormones contribute to it. If you're
Really?
20% over your ideal body weight, people who tend to wear tight clothing around their abdominal area.
Lord.
Yes, yes, yes. Taking birth control pills,
Oh, dear.
pregnancy. Because you see, Sharon, the veins function to take the blood back to the heart. Veins have valves that control the blood flow.
Yes.
So the blood is coming up from your legs going toward your heart and passing through the valves. So with pregnancy, when the uterus enlarges, it puts pressure on that big vein. All the veins drain into one big vein in the abdomen. And so what the uterus enlarges, it puts pressure on that big vein and causes the blood to be pushed back into your legs. Popping those valves
that's what
open.
it is.
Yes, popping those valves
and
open.
the valves are popped open
And
and
so
they stay open.
They stay open, and well, sometimes with pregnancy, after the baby is delivered, then and the uterus shrinks, then they go back to normal. But for the most part, a lot of people with long periods of standing, if you have a job where you stand a lot
Yes,
or
yes,
sit
yes.
a lot, like nurses, I have a lot of nurses, people who work in hairdressers,
I can
people who
imagine.
stand a lot tend to get a lot of spider veins.
Wow.
And when patients come to see me, actually, I do a screening because it's not just the little spider veins is the problem. Sometimes there are bigger issues going on
Yeah.
underneath.
Yeah.
They may have a leaky valve that they're not even aware of
I
and
see.
causing symptoms in the leg, heaviness, tiredness.
Yes, a lot of people
sore.
complain of that.
Yes, and that can lead to varicose veins. Varicose veins,
Now, varicose veins. So spider veins and varicose veins are different?
totally different. Varicose,
I didn't know that.
Yes, varicose veins are when they're bigger and bulging. But when I see clients, I do a screening. I do what I call a Doppler exam, like an ultrasound, to listen to the blood flow. Because I can tell if there's a leaky valve before the vein is bulged out to see whether I should send them further to get the valve taken care of
Yes.
before doing the spider veins. Because it's like it's a circuit system. The bigger veins flow into.
Yes.
So if you don't take care of the bigger vein first, it makes no sense taking care of the little veins at the
So
bottom.
you go to the source.
Go to the source, take care of that. I always say to patients, you're wasting your money if you have me do the. I'm in the business to make money,
Yes.
but I want to be honest. If you want to get the best results, you have to take care of the larger veins first before taking care of the smaller ones.
But so what do you do then in the case of spider veins and varicose veins?
In case of varicose veins, a vascular surgeon is the one who specializes in taking care of that.
Yes.
And what he does, they do a laser to take care of the varicose veins. It's a catheter passing through they make a little incision about the knee area. They pass a catheter all the way into the groin area because usually that's where the leak is.
Yes.
Pass the catheter all the way up. They turn the laser on, and then they slowly pull that laser out.
Oh,
And
so
when
as
they-
it's coming
as
out.
as it's coming out, the vein collapses.
Oh.
Yes.
But so in the case of varicose veins, if you have a whole lot, like a world map on your legs,
Yeah.
you have to do each one individually?
Yes,
Oh my
and
Lord.
usually one leg at a time because after the process is completed, the leg is wrapped, a compression stocking is put over that, and that stays on for like 7 days without taking it off.
And what, sorry?
Walking is very important with that too.
You have to
You have to walk
improve your
afterwards.
circulation.
Correct.
Oh.
So after they're taken care of the varicose veins, then they come to me to do the spider veins. And that
And you do it.
I do the spider veins.
Okay.
That entails injections. It's a solution that is injected into the vein.
Oh, I see, and it dissolves it or
what it does
is
it scleroses it. It causes the veins to collapse. It does it over time though. Say for instance I did your veins today. I inject the veins today. In about 2-3 weeks you'd see some of the veins disappear because they have collapsed and fade out of view.
Oh, okay.
However, it takes multiple sessions, and that's because your body responds differently.
But that must be expensive.
Not exactly. If you think about the symptoms you're having.
Oh, there are symptoms? I thought they just
even with the spider veins.
Really? I just thought it looked...
It's not just cosmetics.
It's painful or something?
Sometimes you do get heaviness, tiredness
oh, yeah, you did
of
say
the
that.
leg. Not just with the varicose, but even the little spider veins can cause that. But for the most part, patients come to me because they just don't like the way they look.
They don't like to see it.
Yes.
Yeah,
Yes.
it's like
It's
a
unsightly.
map on you, yeah.
Yeah.
Okay, but do you find it more prevalent in black people, say, or white people?
We all
Or
have them.
Asians?
We all have them, but because of the color of our skin, darker skinned, it doesn't show as easily
I see.
on the fairer skin clients.
Yes. Oh, yeah. I've
Yes.
seen those, and they're blue and almost
Yes.
scary looking.
And a lot of times too, you see it looks like a big bruise.
yes.
Until you go closer, you realize it's really
It's a whole set of little veins.
set of veins.
Okay.
Yes.
All right. So then,
It requires wearing the compression stockings. I have my clients wear compression stockings overnight, sleep in
Yes.
them one night, and then continue to wear them for 5 additional days
constantly?
during the daytime,
Okay.
all the way up to bedtime. Because what the compression stocking does, it does two things. It's built with what's called a graduated compression. So it has different compression along the hose to move the blood up out of the legs.
Oh, I see.
And also because it compresses, it's kind of pushing the walls of the veins together like you're trying to glue them shut. So it does
So it
help.
helps it heal.
Correct. And I also recommend that you wear them when you fly. Or
Do you?
Yes, I do.
You do?
Yes, I do.
But don't they? You see, the thing is with us ladies is that when
It's the
things are
fashion.
Unattractive. It makes you look like
Well,
a
you dress
old
accordingly.
person.
No. I have compression sleeves that I wear to the gym.
Oh yeah, I've seen
Yes.
those things on television.
That goes from the
advertised.
ankle to the knee.
To the knee, just that.
And guess
little
what
part.
that does?
What?
It gives you endurance. When I go to the gym, I can go forever with those on because it's
Okay.
moving the blood up out of your legs. So it's giving you more energy.
Okay.
Yes, especially if you have an issue with the veins to begin with.
Oh,
Yes.
interesting. Would can I put it on while I'm walking?
Yes, because my clients are required to wear it even while they're walking because walking is a requirement after treatment.
Oh,
45
okay.
minutes to an hour of a continuous walk every
But not
day
brisk
for 2
walking,
weeks.
just
It doesn't
a
have to
bit.
be brisk, but you can. If you're a person that exercises, you can do power walk.
Oh, okay.
Because after the treatment, I say no running for 2 weeks. Because
That's
running
too
pounds
much
on it, and
impact.
yes, and that
Okay.
would pop them open when you're trying to shut them down.
Okay. Wow. I
Yeah.
felt that in my knee. So then, what else do you do? Okay, let's get to the brass tacks.
Okay.
For the
Okay.
face, okay, I have always had it's a family treat. We have bags,
Right.
right? But like a little handbag, like a clutch purse, right? Now I'm toting around a whole set of luggage, matching.
Matching set.
Yeah, and especially when I'm tired or if I don't sleep properly, the next day, well, you can look at them.
Yes.
So what would you do?
Okay. For the first thing, you know, what we see on the outside is a reflection of what's coming from the inside.
Okay,
So, do you drink a lot of water?
I drink enough.
What
Okay,
you
sometimes
consider
I forget.
enough.
Okay, sometimes I
okay.
forget.
What you consider enough may not be enough. So that's a sign.
More
More water. Yes. You should be drinking actually a half
glasses a
in
day.
liter your body size, your body weight in liter per day. That's a lot of water.
But you must be out.
You
of
should
your
be going to the
mind.
bathroom very often.
But if you,
When you pee, it should be clear.
yes,
Yes.
except when you're taking your B12 and then
Right.
neon yellow.
And when you eat asparagus, it comes out. Yes.
Yeah.
Okay.
Well, I'm good with that. I mean, I can always know. And like I always say, I'm diabetic.
Mm-hmm.
So I tend to get dehydrated quickly.
Okay.
So I can know when I need to drink water, and then,
But
you know,
don't-
like I wake up and I feel funny in my core.
Right.
Right?
But you shouldn't wait until you need. You
No,
should be
I try-
constantly drinking.
I try to drink water every day. Like normally when I'm sitting here, you see, you distracted me. I have a glass here and I have 2 glasses.
Okay.
And then before I leave, I go to the bathroom, get home or wherever.
Right.
That's normal enough, isn't it?
No.
It's not?
That constantly you walk with your water.
But there's
wherever
also
you
the
go.
study that says you can't drink too much water
Well,
because
true.
you dilute your salt. So
But
how do we
still-
know what's a happy medium?
But you, in between everything that you're doing, you take a sip. Take a sip. Constantly throughout the day.
I'm quite proud of myself. I used to go months without drinking water.
Wow.
Uh-huh.
And you could go hours without peeing.
No. Pretty much.
Well, as I said, what's
So
on the inside reflects on the
manifests
outside.
on the outside. Okay, so you're saying I really should be drinking. Okay, if you, Madge, go Hagen, say to me right now, Sharon, if you drink water, the bags will go away. I'm drinking water.
Okay, so that's the start. How about the diet?
Now,
Are
I
you
really
eating
must
lots
say
of fruits and
things.
vegetables?
Oh, yeah.
Okay.
I love that.
How about your carbs? Are you cutting out carbs and sugars?
Okay, now let's talk about generally now.
Okay.
Let's go.
And alcohol?
No, I don't really drink. I had 2 glasses of white Zinfandel last night and I was stumbling.
Okay.
And my knees go weak with a shandy. I
Okay.
promise you.
Okay.
No, but you're saying as you're getting older, you should pay more attention.
Correct.
Right.
Correct.
To diet, to drinking water,
Right.
and what else?
And your exercise.
And exercise.
Exercise.
Okay. Having done all of that, and you still have these darn bags, then I come to
Okay.
you.
Then that's where Magical Hagen fixes you.
Okay, yeah. I think we at that point now.
Okay, right. So with aging, the aging process, we tend to lose elasticity in our skin, and things start to go south on the face.
We knew this.
So
Over the body, not only the face, everywhere.
everywhere, and that's why exercise is very important to keep everything pushed back up.
Yeah.
As along
To
with
try.
yes,
keep
to try,
everything, yeah.
to try.
Oh, yeah.
Okay, so fall short of doing a facelift, which is invasive. There are other things that we can do that is non-invasive,
Okay.
like Botox.
But then, doesn't Botox just like freeze the muscles?
It's not, I don't say freeze, I say relaxes.
It actually relaxes.
It relaxes.
What about those pictures we see in the magazines where people look so surprised, like their eyebrows
Because
stuck up there?
Because they have gone to someone who have overdone, or they just don't know exactly how to do the treatments.
Okay.
I don't do that. I like a person to look relaxed
And natural.
and natural.
Yes.
If a client comes to me and say, I don't want my face to move at all, I said, you may have to go to somebody else because I don't do that. I don't want you to go out there and represent my work
Exactly.
and people to look at you and say, that was Madge. No.
Yeah.
Because I do my own treatments and I am as natural as it comes. My face, I should still be able to make expressions.
Yes.
But-
Oh yes, that's true. That's another one. It's funny.
Yes, yes. So what Botox does, it relaxes the muscle. Actually, it gets injected directly into the muscle, but it actually works on the nerve endings. You have nerves that send a chemical over to the muscle to cause the muscle to contract. So we're actually blocking the release of that chemical from the nerves to the muscle. However, in about 3 months, the nerves find a way of getting back to those muscles and they start working again. That's why Botox has to be done.
If you do
every 3
Botox,
months.
you have to do it every 3 months.
Every 3 months. And for some people, the younger you are, the longer I've found that it lasts for you. So the younger people may have to do it. They do it twice a year.
Oh, nice. That would be nice if somebody was able to.
Yes,
just do
but
that.
I find the older you are, I guess the way your metabolic, your body metabolizes things, it's different. So you have to do it a little bit more
So,
often.
but you don't do like sculpting.
There is a product called Sculptra that was approved for patients who HIV and they have atrophy. They're losing a lot of muscle in the face, so that's particularly for that.
For them.
But other people have used it. I use what's called Juvederm. Juvederm is a dermal filler, and I put it mainly in the cheek areas. See those lines that along the nasolabial fold?
Yeah.
Years ago, yes, that was the method, to inject it along the nasolabial fold. But the newest technique now is to put it along the cheeks. When you pull
Like
your
when
cheeks
you
up,
sculpt in.
you see how it pulls.
Contouring, right?
Yes, and it pulls those folds
Yeah.
by your nostrils out.
That's why you have to comb your hair in one now. And
Well, when you do that, when you do that, you comb your hair and it pulls up.
Yeah.
So that's what you're trying to do with putting a filler in. And the filler is what's inherent in your body, hyaluronic acid. So that's
What
putting
acid?
hyaluronic acid. It's already in our bodies. So that's what we're kind of just putting back.
Oh, when I said a filler, I thought like you were injecting collagen.
It's not collagen. It's hyaluronic acid, which is
Okay.
actually already in your body. So you're just replacing it. And if I injected you today, you see immediate improvement. However, in 3 months, you continue to see further improvement.
Really?
Yes. And it's and I always say to clients, go lighter and just wait. If you need more in 3 months, then we reevaluate and do a little bit more.
Okay.
Don't put too much, then your cheeks are puffed up and you look like a chipmunk, you know?
In 3 months' time, you look like a chipmunk.
Exactly. So you just go slowly, a little at a time. Just build up gradually. And, it's not as expensive as a facelift. So we call that a chemical facelift.
Okay. But that's interesting. So, but you only practice in the United States.
Currently.
My plans.
My plan is to take this to St. Lucia. Yes.
I like that.
In the near future.
Okay.
Yes. Working on that.
You working on that?
Yes.
Okay, so there's that. There's the fillers.
So
What
a
else?
combination of Juvederm and Botox give you that chemical facelift.
But you only deal with the face.
Correct.
Okay, so we can't talk about tummy tucks.
No.
But how long does it take, the process, if you were to do a filler?
To do a filler, because I put a little numbing on the skin, I would say 30 to 40 minutes.
That's all?
Total, yes. Come in and get it done. I use ice as well to help with the numbing
business,
process.
man.
Yes,
Just get
it
the
is.
business going.
It is, and
Wow.
a lot of people are doing that now because you don't have to be cut like a facelift,
Yeah. And it's becoming so competitive in the work market. You have to look your best.
Oh, definitely. So that's the way the world is going now. Everybody's trying to get a refresh, or just to be rejuvenated.
Yes.
Yes.
Has your business increased in the last 3 years?
Oh, yes, tremendously. And I find that I'm seeing younger and younger people.
Really?
And that's the best way to do it, if they come in early and start early, especially with Botox. Because, with the Botox, the constant pulling of those muscles causes an engraved line in your face. So you want to get to those before you start to make the lines.
But, question, not how safe, but don't those things have a negative impact on, say, your kidneys and your liver?
No. It has not
It's
proven
just processed and
it has
passed out?
Especially Botox, in 24 to 48 hours, that's totally out of your system. It does this thing and it's out of your system.
So,
And years ago, actually, and the minimal amount of Botox that you inject, years ago, they used Botox for people who have what's called dystonia in the neck, where the neck was, bent in a particular direction and just they can't move it. So they use it to relax that. And you can safely inject 3,500 units at any one time of Botox.
That's a lot.
And when I do a client, the maximum probably 70 units of Botox. And that's usually a male, because both males and females do Botox.
That's the question. How many, on average, do you see a lot of men?
Yes, it's predominantly females though.
Uh-huh.
Because the guys are, they're
Yeah, it's
macho
the whole
and
thing with society too.
Yes.
A woman is always supposed to look young and pretty and quote unquote viable, whereas men can be crusty and old and
Right.
fat, and it's fine.
Yes.
That's not fair though.
It's not. But it's the same thing with trying to lose weight. The guys, they go to the gym, we're doing the same things, and they lose it faster than we
know.
do. It's just not fair.
So you've been here, how long have you been coming here?
It's since earlier this year.
Oh, it's just this
Just
year,
this
that's
year.
fresh and
This
new,
year.
your love affair with Saint Lucia.
Yes.
Yes, what were you going to say?
Oh, in addition to the Botox and the Juvederm, the dermal fillers,
Yes.
there's skincare. And St. Lucia, you have the best thing here
What's that?
for the skin,
What's that?
that volcanic bath.
Oh, yeah.
The first time I did that, my skin was glowing for
And doesn't it
months.
feel
It's
really
awesome.
good?
Awesome.
Yeah.
You know what I do now, which all St. Lucian females should start doing?
What's
Using that sulfur soap or that black
Yes.
soap. I use that every night on my skin.
on your skin? Because you have beautiful,
Be-
you genetically have beautiful skin.
It didn't start there, Sharon.
Really?
No. I used to go to the shower and use whatever soap I'm using to wash my skin,
Me too.
to
I
wash my
do
face.
that.
No. Now I do that differently. Once you start taking care of your skin, you see the
That's
difference.
true.
My skin feels so different now. And what I do with that soap, and this is just your tip for the day, the sulfur soap or the black soap that you can get in the market here,
Yeah.
I wash my face with it. Then while my face is still wet, I lather it on. I let it stay on there for 40 to 45 minutes. It dries like a mask.
Yes. Oh,
Leave
it
it there.
does.
Then
the black soap from the
blacks
market?
from the market. And then I wash it off with warm water, followed by cold water.
Yes. Open and close your pores.
Correct.
So, I was going to ask you something about your skin regimen. I forget. Anyway, being here, when I was asking about your, coming to St. Lucia, what has been your observation about women and their skin here?
I have noticed that a lot of the skins that I've seen, the pores are open. A lot of large pores.
Pardon me.
And some have a discoloration.
Yes.
It's not even toned. Yes, and I think just using that sulfur soap, just starting there, would be tremendous
And
help.
of course, drinking water.
Drinking water. And another thing, vitamin C
Uh-huh.
does help the skin as well. So taking vitamin C on a daily basis, I would say 1,000 milligrams a day.
Oh, okay.
It not only
That-
helps your immune system, it also helps your
Your
skin.
skin. So that's 1,000 milligrams of
Vitamin
vitamin
C.
C. A lot of sleep. Well, a proper.
Definitely.
Yes.
Definitely.
I haven't been getting a lot lately. But
Well,
I'm
with
gonna
the
get back on
season,
that.
yes.
Yes. Then water and the black soap. And you think you'd be doing
That would
fine.
be a start.
But what about people who have chronic eczema or acne? Do you treat that as well?
That the sulfur soap is a start for that too.
Really?
There are clients that have, especially the guys who get these razor bumps, and I have gotten tremendous improvement with just using the sulfur soap. With
So you recommend that now?
The sulfur soap, yes, starting there. But sometimes with the acne, they may have to see a dermatologist because they may need to get some antibiotics, get on board.
I've never ever had acne, no, knock wood, but I understand there's adult acne.
Yes.
I think that's so scary.
It is, and I find that retin-A is vitamin A. Using that for the skin also helps with adult acne. using it at night. The one main thing, which is for solutions, because of the sun, it can have a counter effect. So you have to be careful about being in the sun.
But in the Caribbean here we tend to have.
But I live in
dry
Florida
and
too, and I use my Retin-A at night.
Mm-hmm.
But I'm very careful with being in the sun. You make sure you use your sunblock.
Sunblock or a hat.
Yes,
Mm-hmm.
yes.
Be walking around.
But I mean, it's basically laying out in the sun that you get the bad results.
Yeah.
But moving around, you can't help but being exposed to
Yes.
the UV lights.
It's true, and you know it's invasive even when you're inside. So
Exactly.
There's no way you can really get away from it.
Correct.
Okay. What else? So you don't do things like eyebrow lifts and.
You can do that with Botox.
Oh.
Yes. That's why I said a chemical facelift.
Do they do Botox hair?
I do believe.
Have you heard?
I do believe there's someone
That you
here
do?
that does it.
I don't know. I don't know about it.
No? Okay. Well, I will be taking it here.
Okay.
I'll be taking that here.
How soon?
I believe
You should see
early
the
this
face
year.
When?
I'm ready to be in St. Lucia. I love St. Lucia. Oh, if I
But
could
you're
be
from
here.
Jamaica,
I'm
right?
from Jamaica.
Did you grow up there?
I grew up in Jamaica. I left for the United States in 1987.
Oh, okay. Yeah, that's like 27.
Yes, but I do go
27,
back.
29 years ago. What's it?
It's 26, 27 years.
Right. Yeah, something so.
Yeah, we don't do maths anymore.
I know, right? Just whenever.
Yes.
And you sure you would like to move back into the Caribbean because we as an island we're constantly bombarded by sea spray and stuff like that. We not even sea blast, that's what we call it.
Okay.
And the environment here, the atmosphere here is very harsh for your skin.
And that's why you need more soap to take care of the skin.
You need more?
You need more soap to take care of it.
Oh yes, that's true.
Yes, and using moisturizers at night is very important as well.
Okay.
After using your soap to do your face, then you use
But then,
moisturizer.
can't you do your face without using soap at all and just use...
But to clean the pores.
Mhm.
And the sulfur soap is antibacterial. So it gets all the grime and stuff that you from the day out of it. So it's very important
Yeah, because
to do
you
that.
need to wash off whatever happened
Yes.
during the day.
From the environment, correct.
Okay.
And using a moisturizer. Sometimes I use olive oil on my skin.
But doesn't olive oil and these oils clog your pores?
You would think that. I use it at night. And I put it on, and I'm there watching TV. And before I go to bed, you would be surprised to see how much your skin has absorbed that oil. Because you need it. You do need it.
What about coconut oil?
Coconut oil or vitamin E oil. Any of the three
Yes,
I have used.
You can pop the capsule
Yes.
and just use it, right?
Yes.
Maybe add it to your moisturizer.
Correct.
So it can
Yes.
smoother.
Yes.
Shea butter is really good.
It's
too.
very good too. Shea butter is very
And then
good.
if you have to emulsify it, first like stick it in the microwave or...
Yes.
See, I know those
You
things.
do know a lot, Sharon.
Because I chat to you, I'm always asking people questions or things. So I get to know. Alrighty, Madge, what else? What other advice can you give us for our skin?
Well, I do believe once you take care of the inside, drinking your water, exercising, eating right, and doing your daily regimen, you have to be consistent. Consistency is the key to
So
getting
what you should do is
results.
to establish a routine, say in the
Establish-
morning at a certain time.
And even if you just do it at night, you say in the
Just
mornings
be
you don't have time.
consistent.
Yes, just be consistent at night. Do your routine. Get
Okay.
your moisturizer on.
For the people who don't know, what is the routine of taking care of your skin? So you get ready, you put on your makeup and everything, you went through the whole day, went to work, it's time to go to bed. And so what do you do?
Okay, you cleanse. First thing, you want to cleanse. If you have toner, you tone.
I thought they said that was not a necessary step anymore.
It does help. I don't always do it, but 2-3 times a week I do a toner.
Okay.
I do tone. Then you do your moisturizers. Get that on. and you go to sleep.
Mm-hmm.
You get up in the morning, you do your cleansing again.
You wash it out.
Yes. And once per month, it would be nice if you would get a really good facial to take away all that dead skin.
And the deep-rooted dirt.
Deep, yes. You'd be surprised
I've
to
never
see how
had a
much.
facial. Can you imagine that?
Wow, you'd be surprised to see what comes off.
Really?
Yes, all that dead skin. So
Yeah,
that would.
And it must feel awesome.
It does. It makes your skin feel like it's a baby skin again. But if you take care of your skin, you're laying the foundation for your makeup to look flawless.
Yes.
If you have.
What about those people who don't wear makeup?
Well, even so, your skin
Even
looks
better because it
yes,
will be glowing.
Exactly.
Okay.
You know, Sharon, I also model. I'm also a model, and occasionally I've gone on auditions where it's for a skincare line, and they tell me, "I'm sorry, but I can't use you. Your skin is perfect."
Wow.
And you would think that they're looking for that, but they're not looking for that because it's modeling.
Because
They're looking for
before and
afters, right?
Be too much
But
of an after.
it's a good thing
Yeah,
to be
it's
told.
flattering,
Yes, to be told that you have perfect skin.
Yeah, that's really,
Yes.
really good. So you said it didn't start off like that. Like
No.
going through your teens, you had the acne.
Oh
or the
yes,
pimple?
yes, I did.
Seriously?
I did, and even sometimes, occasionally I go on vacation and I don't take all my products, and I suffer because then adult acne starts breaking out. The last time I was here in St. Lucia, I didn't have my products. When I went back, my forehead.
But you know, it can be so tedious, and you know, women are always juggling. You have to get the family up and out of the house.
Yes.
You're always doing something.
I know.
And we tend to put ourselves last. So,
Yes. And then you're thinking about traveling. You're allowed 50 pounds. Yes. So all of
you
that
can't
going
even carry
through.
that in your hand and luggage because
Exactly.
it's liquids. and
Exactly. So
It can spy against us, you know.
Yes. But you have to try your best. Bring whatever the necessary that and continue with that. And when you're on vacation, still continue to exercise. We went walking this morning. We went to the gym this morning.
That is how I backslide.
Oh,
Always.
No.
When I come back, it's like, oh my
starting
God.
over.
Yeah.
No, I continue. It's
Mine too. I intend to because the what they say, but the spirit is weak.
the heart is willing, but the flesh is weak.
I'm telling you, I pack all my
Your gym-
exercise stuff to go, sneakers and socks, everything, and then I just never ever do it.
No, I make time. You have to be disciplined. It starts with the mind. So start working on the mind. It's a mental process. Start working on the mind.
So you have
And
your
everything else.
beauty regimen, you have your
Yes.
exercise regimen.
Yes.
Yeah.
And a spiritual
Yes.
starts with the Almighty.
Interesting.
Yes.
Very,
it has to
very
be balanced.
interesting. Yes, it
Yes.
must be. Okay. My dear, thank you. Thank you for stopping by. We're looking forward to Madge's beauty clinic, coming up soon in 2015, I hope.
Correct.
Right? And so we can go get our skin done and our fillers put in.
Yes.
And you probably will do a consult on
Oh,
diet.
definitely.
Diet and
Definitely. I
exercise.
always advise my clients
Mm-hmm.
on what to eat and, do your exercise and drinking. Because
Yes.
it makes no sense doing this if you're not taking care of the inside.
Yeah. And so the problems just come back over
Correct.
and over, right?
Yes.
Okay.
Yes.
Thank you.
It's my
for taking
pleasure.
the time.
It's my pleasure.
Alrighty. So we've been speaking with Madge Gohagan. What is your surname?
Gohagan.
No, that's what
I'm
I
a
was
physician
asking for.
assistant.
A physician assistant. No, I was going to ask you what was the Madge short for. Is it
Oh no, it's
Marjorie?
Madge. M-A-D-G.
Really?
Yes.
Oh, shucks.
Not
I
a
can't
short.
even tease you.
Well, Maggie Boo. We're friends on Facebook.
Yeah, but that's cute. I wanted to tease you, like call you Marjorie or something like that.
Maggie.
And I'm wishing you a fantastic Christmas here in St. Lucia. I think we do it really nicely. This would be your first Christmas.
My first Christmas here.
People, you should have seen her in her Junior Creole Madras.
Oh, yes.
Jamaican living in Florida, representing
Representing.
the 758. Yes. So if you're gonna be going house to house, I guess it's the same.
Yes.
How you do it in Jamaica.
Yes.
Yeah.
The difference in Jamaica, though, than what you have here for Christmas, and I was telling Sharon last night, Christmas Eve, all the stores are open. All the way up to 5 o'clock in the morning.
What? I like
Yeah,
that.
we do all our shopping on Christmas Eve. We
I
shop
like
right
that a
through.
lot.
The streets are blocked off. Music is playing. Food all everywhere. It's a
like a
time to
big
party. It's a
party.
big party. Yes.
So what time you get to your home to finish off?
Well,
do what you have to
you
do.
get home in the morning. You go
So
to
you better
sleep.
have all your stuff done by then,
Yes,
right?
yes. So most of the shopping is done on Christmas Eve.
That's nice.
Yes.
I would love that.
We look forward to Christmas Eve.
Great. So we doing it next year?
In Jamaica?
Yeah.
Yes.
Yes, we gotta
We're
go
looking
to
forward to
Jamaica.
having you in Jamaica for Christmas, Sharon.
You think y'all can handle that?
I don't know if Jamaica is ready for Sharon.
Handle all of this. Alrighty. What is the time? It is 11:15, and thanks again, Madge, stopping by and letting us know. And as I said, we're looking forward to that. I'm going to be your first case study.
Okay. I'm
Right,
looking
that's the
forward to
deal.
that.
And then I'm going to come back here and say it was nice or no good, I don't think so. We'll see. And
will be
we'll
happy.
try your tender hands and see.
Yes,
Yeah.
I'm very
Or is
gentle.
it painful, any of it, honestly?
It's virtually pain-free, I would say. And I do use numbing. So and the needles are so tiny. It's
Oh,
very
okay.
tolerable.
Yeah,
I do
my.
my
You see, they pinch this thing and they inject it.
Yes.
So
but I do my
scary.
own, so can you imagine?
really, so you can walk around with a kit like a diabetic.
Not exactly. I prefer doing it in a controlled environment.
What's the worst that could happen? I know our interview's finished, but tell me.
For some people, they get nervous and they might faint.
Oh, okay.
Yes.
But if you, because Botox freezes the muscle, basically
It
you said
relaxes.
relax.
Yes.
So if you are panicky and frantic, will your face stay like that?
No,
when you're
no,
injected?
no. Because it takes up to 14 days for it to work. So it doesn't, it's not an
So it
instant.
doesn't work for 14 days. It takes
Up to 14 days.
So
Like
it's
for
really
me,
be-
for me, I do mine because I've been doing it a while. In 3-4 days, it starts working already. Because see, I did mine before I came here.
So do
And
this.
see, I'm trying to do it. See, I'm not making the line like you. When I don't have Botox, this is what it looks like.
Oh, okay.
Yeah, so I'm able to pull that muscle all the way like that. But
think
see,
you
now I'm doing
should.
it, but I'm
Yeah.
still able to make expression.
Yeah.
See?
Oh, yes, that's important.
Yeah, for some people they're doing this and they're talking and they're like it's not
Yes,
moving at all.
Like how Joan Rivers was before. she
Exactly. It's just too much. It's overdone.
much.
It's overdone.
So how do you know when your body has had enough and you need to stop this and go back to nature and age gracefully?
No, it's because like with Juvederm, the filler, it lasts a year. You know, it's FDA approved to last a year.
Really?
Yeah. So you have that and you see it and it's not going to go right back to where you began.
Oh, I see.
Yeah.
So it improves.
It improves it.
And
Because it
continues
also helps you
improving.
build your collagen as
Oh.
well.
So what do you say, finally, what do you say to people who are naysayers and they say, you know, you should age gracefully and come to terms with the fact that you're aging, you can't be young forever, etc., etc. How do you combat that?
Well, I do tell them it's a choice. You don't have to do it. If you're confident with the way you look and you're happy with it, you don't need to change it.
Yeah.
Yeah.
And
But
to
if
each
you
his own.
Yeah, to each his own. If you are uncomfortable with something and you'd like to make a little change, do it.
So people,
What's there to lose?
people normally do the lines by their mouth, by their
By the mouth,
noses.
right?
Okay.
And sometimes there's a muscle here too that tends to cause the corners of the mouth
To droop.
Yes, making you look like you're frowning.
Yeah.
So there's a muscle down here that I inject a little Botox that gives you back your smile.
Okay. Turn that frown upside
Yes,
down.
Botox can be used so many different places, or even on the neck. You know.
Yeah,
These
or if
lines.
you have like double chin, I've always had a double chin.
Well, I have what's called like a body wrap. I don't know if you've ever heard of those. It's It's all organic material that's infused in a wrap that I put on the neck area.
Okay.
And that stays on for 45 minutes and take it off. And that
tightens.
yes, helps to tighten the neck. Yes.
Oh, Madge,
so many things to count.
Friend, right?
Yes, we're going to go exercising together.
Okay. Right.
Now I lost you.
But I need to. I recognize that I need
It's
to.
very important.
My health, my appearance. Well, when I was a teenager, I started smoking.
Bad
cigarettes.
move.
Exactly. I didn't do it too long. And it was only socially, because, you know, when you go out, there's no peer pressure like people will ask you, but, you know, you just try to fit in, I suppose, and slip into what's happening. So, and plus, I used to have, because I had beautiful nails, so you want to show off your nails.
Okay.
But then I had a moment of realization that you're taking in this poison into your body, and secondly, you're releasing the smoke, and you would get wrinkles.
Exactly.
I stopped that cold turkey. Not to say that I was addicted or anything. I stopped that nonsense right away. So now you're telling me about my face and exercise and water.
And you see,
I'm going to do it.
Talk about smoking. The lines around the mouth from smoking.
Yeah,
Or using a straw.
Yes, oh yes.
Yes. Eating spaghetti.
Yeah.
Sucking that up spaghetti. Yeah, you get those lines that you don't even have
really
to
bad
smoke to get smoker's lines.
Flawless.
Yes, and I do have a product called Bellatero for those finer lines that are on the surface.
So you would apply it.
Yes,
on a
it's
regular
injected
basis?
actually.
Oh,
It's injected, yes, into those lines.
So you don't have anything that's applied topically?
for wrinkles now.
So all those products that say use that, and that's not true.
It's temporary.
So you can save your money, you're saying?
I would say that, yes.
But somebody was telling me, I think it was a dermatologist, and was saying once it had retinol, retinol really does work.
Retinol is a derivative of Retin-A, but it does help. But I would suggest Retin-A. Retin-A is
the
prescription product. Yes.
Okay.
Yes, and you can get Retin-A from your dermatologist.
Very good. Very good, my dear. Alrighty. So that's where we say goodbye. See, we went to 11:20. Didn't realize, right?
No.
And as always, my guests on Chip Chat Live, I'd like to invite you back anytime so you can, you know, give us an update on what's happening.
Sure.
With the move.
Yes.
And with any other new procedure, or
I sure
anything
will.
that you're doing.
I
okay?
sure will. Thank you so much for having me, Sharon.
Thank you.